Good afternoon. Thank you for those updates, Governor. And thank you to the teams in North Smithfield and Woonsocket for hosting us today, including Town Administrator Zelensky and Mayor Baldelli Hunt. These press conferences have been an important part of our COVID-19 response. While we post data 5 days a week online, these press conferences give us an opportunity to put a little more context around those numbers and to welcome you as ambassadors in spreading the news and the important information that we're sharing. In going through our data and in adding context to what we're seeing with our data, we have always pledged to communicate with you directly and transparently so that this is the place where you can come to get the information, know that the data is going to be accurate and is going to equip you and your loved ones with what's needed to do best, calmly and confidently. In continuing that spirit of directness and transparency, I want to share what we are expecting January to look like. It indeed is going to be a difficult month from a COVID standpoint. It's not only here in Rhode Island, it's regionally and it's nationally. We're in an unprecedented moment within an unprecedented 2 years plus period of time. The shift indoors with the colder weather, the heightened transmissibility of the Omicron variant, that's double what we were already saying is occurring with the Delta variant, the holiday gatherings, and the general increased levels of social interaction all mean that we could sustain case numbers through the middle or end of January that will well exceed the peak we have ever experienced throughout this entire pandemic. That's why it is so critical, and it's great to have a reestablishment of that whole of government team. So we're glad that Director Pappas is here and helping to provide that structure with our other state agencies, joining in with the engagement with General Callahan and the amazing Rhode Island National Guard, and what we've been doing at the Rhode Island Department of Health and across all of the agencies. Really having that unified effort together is going to be critical, getting us through the rest of the next several weeks. This week, we have already had 3 days with more than 3,000 cases each day. And we believe that what we're seeing now is still predominantly Delta variants of COVID. Our rough estimate is that only approximately 10% or so of infections in Rhode Island right now are Omicron variant cases. What I said when I was with you last still holds true. If you're going to do just 2 things to keep yourself and your family and loved ones safe, they should be these 2 things. Wear your mask and get vaccinated, particularly get boosted. That's going to give you the full protection that you need, particularly as we prepare for the Omicron variant becoming predominant. Number 1, masks work. We know that. Anytime you leave your home, bring your mask and put it on when you are around other people. Number 2, the COVID-19 vaccines we have are very effective at preventing serious illness and hospitalization. Those are the key things that we have been saying since day one pertaining our vaccines. They are excellent for keeping you out of the hospital and for keeping you alive. Analysis after analysis of our own Rhode Island data is showing that you are much less likely to get hospitalized if you have been vaccinated. And you enhance that protection even more once you get a booster dose. So I really want to re-emphasize, we have this window of time before Omicron becomes predominant. Go today and get boosted. Fortunately, the data nationally are confirming what we had originally believed. While more transmissible, the Omicron variant seems to be causing less severe illness, hopefully. This could mean fewer hospitalizations than you would otherwise expect. However, given the case rates that we are seeing now, as high as they are, and the case rates that we anticipate continuing to increase, we will naturally expect hospitalizations to increase as well, just based on the numbers alone. That's why it's all the more critical to follow those 2 points. They must be layered together to have the greatest effect. On top of wearing a mask and getting boosted so that you're vaccinated with the utmost protection, also think about limiting your exposure overall. Delta variant is contagious. Omicron variant is even more contagious. So, for example, tomorrow is New Year's Eve. If you are in a setting with a lot of people you do not live with, you're just automatically in a higher risk situation. That situation becomes much higher risk if you're not wearing a mask and you're not vaccinated or boosted and you cannot physically distance. You can look either way and already see examples of positive cases that have occurred thus far through the holidays at alarming numbers, friends, family members, neighbors. Take that information, take the tools that we're equipping you with to choose how to behave differently going forward. It's just critical to know that we cannot treat this holiday, New Year's Eve, the way we treated it prior to the pandemic. It's different, but we have the tools we have that can help make it so that we can go forward safely. Wear your mask, get boosted, and limit your exposures. Shifting gears, I want to provide a little more detail on the change to our quarantine and isolation guidance, which the governor referenced. Aligning with the Centers for Disease Control and Prevention, we have shortened the isolation period for someone who was COVID positive from 10 days to 5 days, provided that that person has no symptoms, is asymptomatic, and will wear a mask for 5 additional days. Another change is that if you are a close contact, you do not need to quarantine if you are asymptomatic, you don't have any symptoms, and if you received a booster dose or you completed a Pfizer or Moderna series within the last 6 months, or a Johnson & Johnson shot within the last 2 months. People in this situation should wear a mask around other people for the full 10 days and get tested on day 5 if possible, which is why we're doing everything we can to continue to ensure that the testing capacity that was already top of the line nationwide is going to expand even further. Data consistently show that people who are boosted or who recently got their primary series have the highest level of protection. For that reason, there are certain people who will still need to quarantine when they are close contacts, including people who are not vaccinated and including people who were vaccinated a long time ago and haven't yet gotten their booster dose. We know that this is a lot of information. It's easier to see this guidance and read it so that you can process it even more so than just hearing it. So we have these updates posted for you online on covid.ri.gov, along with a frequently asked questions document that's available. One thing I want to make clear is that updated guidance specific to schools is forthcoming. That guidance will have a broad array of mitigation strategies that we know are critical to layer in place to eliminate unnecessary quarantines and to reduce the workload on school staff while keeping students in person and keeping them and their staff safe. So the quarantine approach for students will be a little different, and we'll be sharing those updates with school leadership soon. The last topic I want to turn to is testing. Right now, the demand for testing is outpacing supply in almost every state in the country. They're seeing it in Massachusetts, in New York, down south, out west, everywhere. The reality is, we're doing a little better than most places in the country. That's what happens when we're leading the nation in testing up until this point, as we will continue to do. Even with the enormous demand we're seeing, more Rhode Islanders are getting tested every day per capita as compared to the residents in almost every other state in the US. So that leading role is going to continue with going forward. We know waits for tests and turnaround times are not where people want them to be right now. You have benefited significantly from a tremendous program that has made it so that those are not norms, and we are not expecting that to become a norm. We are doing everything we can to continue to expand the capacity far beyond we've ever needed in the past, but to continue to deliver the type of services that we have provided to Rhode Islanders month after month after month. We know we will get better. We've been here before. We've done it appropriately. Last year, the turnaround times were well over a week, and we talked about being able to get that down and have consistently since that time had it less than the 48 hours. So with unprecedented numbers, we are confident that we'll get to that place that everyone is comfortable with and familiar with, and we want to charge everyone, particularly those who have symptoms and who need it, to access the testing program that's available. We've started to take steps in the directions needed to expand testing as creatively and innovatively and effectively as we can, the way we always approach all of the changes that we are responding to. We've opened 3 new rapid test sites in Bristol, Providence, and Newport, and we've onboarded another lab to improve our PCR test result turnaround times. In response to the demand we're seeing, as the governor shared, we'll also have many sites open on New Year's Day. Between these changes and the significant influx of at-home tests that we're intending to push out throughout the state, really focusing in on those communities hardest hit, we intend to relieve some of the pressure at our state sites, and our PCR turnaround times will indeed be closer to the 2-day mark that everyone is familiar with shortly. Our last thing that I want to add is that the fastest way to schedule a test at a state-run site continues to be self-scheduling at portal.ri.gov. RIDO's call center agents do not have access to any additional appointments beyond what you can see on portal.ri.gov. As we continue to see elevated case rates, we know that people want to get tested. You've heeded our messages over the months. So we're going to continue to work to get more people tested, and we'll continue to work even with that significant increase far beyond what we've ever seen in terms of capacity. We're going to still work to get you those results even faster. As you know, we always give it our all, and we'll always make sure where there's room for improvement, that's what we focus on doing. The reminder for you is knowing that testing is one component of everything you can do to limit your risk. Wear your mask, get vaccinated and get boosted, keep your groups small, limit your exposure. If you're feeling symptoms, stay home and try to get a test. And if you're unable to get a test early on, just assume that you're COVID positive and change your behaviors accordingly. As I said earlier, we know the next several weeks are going to be difficult, but we've been here before. Rhode Islanders can have the utmost confidence in our ability to respond to this. Although our systems are stretched and taxed, we've been adapting, we've been creative, we've been committed throughout this response, and we'll continue to do that now and going forward, also welcoming the whole of government response to join with us. So now is the time. Folks have often said, you've brought a calm to what's going on, you've created some clarity. Let's grab onto that. Let's take that calm, let's take that confidence of knowing what we in Rhode Island, in Rhode Island have available to us, and hold on as we go forward through this time together. Make the good choices, wear your mask, get everyone you love vaccinated and boosted, and limit your exposures, and we will get through this strong as we have done.